Hi, my name is Sally King and I'm the founder of Menstrual Matters, and this is my story. So 4 years ago I started feeling quite nauseous. Initially I thought it was a hangover that wouldn't go away, and then after a month I thought maybe this is a virus of some sort, and after a couple of months I decided to go to my GP and get it checked out. I had an abdominal examination and several blood tests, and they all came back absolutely fine. There was nothing seriously wrong with me at all, and so I was left to kind of manage the symptoms alone. Sadly, those symptoms got worse and worse through time, and I ended up spending a lot of time in bed with my sick bucket next to me, because this was happening several times a month, and getting quite serious. It was like having food poisoning several times. So went back to the GP a few times. Long story short, after a couple of years of this, eventually had a diagnosis that it was anxiety that was the problem and causing me to feel nauseous. I wasn't too happy with that diagnosis because although I did feel some anxiety, particularly after I'd been sick in public a few times, I was then very anxious to try not to do that again. It's very embarrassing, and people assume that you're drunk. I just thought it was the other way around, that the sickness was making me feel anxious rather than anxiety or some sort of mental health problem causing the nausea. Anyway, I decided, instead of taking anti-anxiety medication, because I didn't want it to affect my ability to do my job or to make my brain fuzzy at all, I wanted to be clear thinking. I thought I'd keep a calendar for a while. I actually thought it might be a food allergy. But after a couple of months, it was clear that there was a relationship, there was a pattern forming, and that was in relation to my menstrual cycle. So very early on in this 2-year diagnostic process, myself and my GPs had ruled this out, because one of them asked, "Is this a monthly problem?" And I knew what they meant by that question, that my symptoms were happening far more frequently than once a month, and they were happening at other times during my cycle rather than just before menstruation, which is kind of what was inferred. Does this happen just before your period? Was the question I heard. And I thought, no, it happens all the time. I don't know when it's going to happen. Can't control it. It's definitely not anything to do with my period. That was my thinking. Anyway, it was all to do with my menstrual cycle after all, and it was when my estrogen levels dropped after ovulation, and then just before menstruation when there's another change in hormone levels. And because I have a 21-day cycle, this meant that I had the symptoms for 10 days out of every 21 days, with a slight gap so sort of 5 days around ovulation time, 5 days around menstruation. So when you're living that's 50% of the days with gaps in between. That felt like it was just happening in a kind of ad hoc way, and that I would have a few days off, then I'd be ill again, then a few days off, I'd be ill again. So once I'd actually mapped this on the calendar, I could see that there was actually a pattern. This meant that my treatment options were quite different. I actually went on the contraceptive pill, which alleviated most of the symptoms pretty quickly. I did then have a major side effect from the contraceptive pill, which was asthma, which got worse and worse over time, and that took 2 years to get to the bottom of, because I and my GPs had no idea that there was a relationship between asthma and the contraceptive pill. Anyway, now I control my symptoms just by diet and exercise, and by wearing wristbands that place pressure on a pressure point on the wrist. The first time I tried these, I had very little faith that they were going to do anything, but they actually work brilliantly and enable me to manage my symptoms without any kind of medicinal, no contraceptive pill or any other medication. So that's my story. Please do share your own stories with me. This whole website is built around women's experiences, and any tips or recommendations you can make to manage any symptoms that you're suffering from. Thanks very much. Bye bye.